Hello everyone. I'd like to share with all of you that recently I have completed ISELA TOT. ISELA TOT means International Social Emotional Learning Assessment Training of Trainer, and received this training from Dr. Allyson Krupar, Senior Advisor, Researcher, Evaluation and Learning, Save the Children, Washington DC, USA. Now I am sharing part 1 of this training with you all, guys. Here it is.
Follow along on your own device. Okay. All right, well, let's get started. So I'm going to share my screen. If we have any bandwidth issues, please let me know, because I know the connection is, we're going a long distance. Okay. So this slide deck I have developed based off of our numerator training guidance. And so we're going to go through this whole deck together. We won't spend as much time as you would spend in training enumerators on the tool, but we will touch on all of the sections, and all of this is designed specifically so that you can use this when training enumerators or future staff on the tool. You'll see on these decks, there are training notes in the corner here, and I will go full screen after I show you this. These are meant to guide your use of this PowerPoint. So for example, this is our agenda for these 3 days, and you would remove this slide when working with enumerators. Does anyone have any questions on what we're doing before I jump into the slide deck? Great. All right, well, let's full screen. Wait, was there a question there, Yusuf?
No question. Thank you.
Okay, I saw you light up, so I wasn't sure. All right, so we are going to spend some time talking about the current study and the purpose of data collection. Mohammed, I see you unmuted. Did you have a comment or question? Mohammed Farouk?
No.
Okay, great.
Carry on, please.
Okay. And so we'll also review a little bit of social and emotional learning. And again, remember that you all may know what social and emotional learning means, but when you're training others to actually collect this data, whether it's people within your team who aren't participating today, or it's people who are just enumerators who you've hired to collect data, you do want to go through all of these topics so you can make sure that everyone is on the same page. And then we'll dive into what ISELA is itself. We'll talk a little bit about the safeguarding and ethics considerations that you would want to talk about with the enumerators and the assent, and we will get through as much of the tool as we can. We will take a break at 1.5 hours. Will anyone volunteer to be my timekeeper? I want to make sure we get a time for a break.
Isubhai, please,
Yes.
you can.
Okay.
Okay. Yeah, it will be 1.5 hours. Okay. Great. So the objectives of the training, both our training as well as when you're training data collectors, is so that the data collectors, as well as you all, understand what we mean by social and emotional learning in terms of this tool. And then also, of course, understand how to administer ISELA, or ISELA A, as we're calling it for adolescents. We'll talk a little bit about the difference in a minute. And then also the translation. So one of the important things that we do is sort of cognitive testing of the tool, where we go through the translation, we consider how child-friendly it is, and we talk about what might need to be tweaked to make it more child-friendly. Obviously, I cannot support with that, but just keep that in mind. That is an important piece because you want to make sure that this is in child-friendly language that children will understand, and that all enumerators are using the same language throughout the assessment. And then, of course, we want to focus on what might come up when we're collecting data using this tool. so issues that might arise, and understand the plan for data collection and data management. And since this is a TOT, we will actually be doing some of that planning itself on Wednesday. All right. So this would be an example schedule for the enumerator training. So when you're doing this data collection, you need to make sure that you're, training the enumerators thoroughly. This is a 5-day training. You can do it in 3, but it is tight. Because you want to go through the whole tool, you want to make sure that enumerators understand your organizational child safeguarding and ethics procedures, as well as, of course, Save the Children's. And then go through all of the different sections, adapt, check the translation. So the enumerator training should occur after we have a translated version of the tool. Even if all of the enumerators speak English, it's just going to make life a lot easier if you have the translated tool. One of the other pieces that's really important that we will unfortunately not get to do together is to practice the tool. So much of the enumerator training is literally going through the tool. One enumerator is pretending to be the child and the other is pretending to be the enumerator, and you then switch. The more practice the enumerators have prior to data collection, the more confident they will feel and the more consistent and reliable the data collection will be. So that is really important in the training for the data collectors. The other thing that's really important is field testing the tool. So again, since this is actually the first time we've used this adapted version of ISELA, we need to make sure that we can test it, we can feel confident in it, that it's reliable prior to the data collection. Field testing means going out and collecting data with children outside of our sample with the data collectors that we've trained. So I know the meal staff here have probably done that kind of work before, but that is a really important step in the data collection training. Okay. So any questions on just the background introduction agenda before I move into the slide decks about social and emotional learning?
I have a question. Field test means we go to the field practically and data arrange a demo session like that.
Yeah, exactly. So the data collectors at the end of the enumerator training will go out and assess children at 1 or 2 days to practice using the tool with children.
Yeah.
But that data collection cannot be part of the final sample because it's just practice. So it will be identifying children that are like maybe in a local school or in a, you can identify in a community center, getting permission from their caregivers and then assessing them on a practice day. Yeah, and we will talk more about the logistics on that as we move forward.
Okay.
Disha, did you have something as well?
May I ask a question?
Yes, please go ahead.
The data enumerator, where it is field test will be by enumerator or data. There is bias. That's why.
I am not getting the question. I think
Please,
it is
noise.
a little bit.
Please keep
The
up.
connection is not
Please,
good.
noise
Yeah,
in
go
here.
ahead.
Please stop noise.
Okay,
Do
can
not
I ask
understand
now?
properly.
Melissa, enumerator will collect data and after that it will be finalized. Is it? Melissa?
Melissa,
So
can you clear the question?
Yes, I think the question is for Ali. So are the enumerators will be the ones who are collecting the data? Is that the question?
Yes, yes.
yes, so your staff as meal staff can be doing the data collection. And you'll see actually in I can share with you an enumerator training guide where you identify, it gives you advice on how to recruit and who should be the data collectors. But typically we don't have enough staff on our meal teams to go out and do the data collection that we need to do. So we have to bring in data collectors who we may have worked with before. Maybe they're teachers in other programs or something like that. I'm sorry, I work in education, so you'll see a lot of my examples are from education. But yeah, we need to think about who will be collecting the data, whether it's your staff or whether it's data collectors that you're bringing in.
Yeah, right.
Yes.
Right.
Yeah.
Word, yeah.
Thank you.
Yeah.
Thank you.
Yeah, and if it's in either case, you want to make sure that they feel confident in the tool and that they're going to consistently collect data. Okay. So you'll see this is in each of the sections within the slide deck that I shared in the chat, which is the same as this. You'll see this learning note slide, and this slide is just for RTOT. You would remove this with the enumerator training, but it gives you some guidance on how long these sections should last, what materials you would need, what the goal of the section is, and any notes that you should consider. Like in this case, one of the things that we'll talk about is the CASEL framework, which is just one of several frameworks of social and emotional learning. And then if you have another framework, especially since the Skills to Succeed program is aiming at older children than ISELA usually targets, and you want to talk more about those aspects, then you can add that information. Yeah, and so your team should discuss the SEL skills that are important for your context, some of which might not be part of this CASEL framework. I'll show you the connections, though, that I could identify between the adapted tool for adolescents and the CASEL framework. Okay. So again, with the enumerator training, this slide deck is meant to be a guide that you can use with the data collectors who are not familiar with the tool. And so this is just a prompt to get people thinking. And we can do this if you want to put these in the chat. So just think about children in your community. What other skills beyond like literacy and numeracy and academic skills do children need to be successful in life or in school? And then with the enumerators, you can have them write these down, put them on sticky notes, stick them on a flip chart. In our workshop here, you can put them in the chat. But again, we're going to move pretty quickly through these activities. Does anyone have any non-academic skills that you think are really important for children to be successful, children and youth to be successful in life? Nazma, do you have some ideas? You're unmuted, so I'm going to pick on you.
Actually, in our community children's in school, their age is 10 to 14 years. Okay, and their academic background is 5 to 8, but they need more digital skill in their class. So from we are giving socio-emotional learning training, also giving them digital skill training. Therefore, they become beyond the academic qualification. They become more enriched about the CLGM and digital skills. So in our community, children from these schools are now they are very interested for the CLGM. Because of the CLGM, they can understand their weakness and their strength, weakness, and everything, and they can sort out their problems, and they can control their self. So the CLGM and digital skill, the curriculum Save the Children has given, this is very, very useful, and it is very impact to the our community children and the school children also.
Great.
Okay.
So we won't be measuring digital skills in this assessment, but we will be measuring those like self-concept, some of the self-management that you're talking about, growth mindset. So we will be measuring some of those quote unquote soft skills or the social and emotional skills. Yeah, so those are great examples that you can gather from the enumerators when you're doing the training.
Yes.
Yes. So the CASEL framework, which I referred to earlier. So this framework, and you can find, there's a link to it here. It's casel.org. This framework is a useful understanding of social and emotional learning, not the only framework by any means. But the idea here is that social and emotional learning involves these self-awareness, self-management, responsible decision-making, relationship skills, and social awareness. And that lands within classrooms, within schools, and within homes and communities. And so it could be with curriculum and instruction, like Nazma mentioned. It could be also, within school-wide policies that are affecting children's social and emotional learning, as well as family and community that affect social and emotional learning. So the ability for individuals to learn and apply these skills, to understand and manage their own emotions, to cope with the daily stress, and then of course to set and achieve goals, to understand others' emotions and show empathy for others, to establish and maintain relationships, and to make responsible decisions. So these SEL competencies are broken down a little bit here in terms of what is included in self-awareness, social awareness, responsible decision-making, self-management, and relationships. I won't go through all of these, but I will emphasize the ones that we will be measuring, and you can refer back to this to learn more about the CASEL framework. So one of the questions again, and this one I think we all know the answer to because we're here and working on the Skills to Succeed program, but what is social and emotional learning? So why should we assess social and emotional learning? And I think Nazma, even when you were talking, these skills are really important. They fall outside of the standard academic curriculum, and they're things that, it will really help children succeed in life as well as in school, beyond what they're learning from their textbooks. All right, so in terms of our a perspective here, Nazma, did you have something to add? I keep seeing you unmute. Go ahead. Okay.
Thank.
Okay, if you do want to, I'm trying to watch when people unmute, but I may not see everyone. So if you do want to chime in, feel free to just raise your hand in the reactions on the top of your teams, and then I will see you. So yeah, just let me know, or you can put something in the chat. So why do we measure social and emotional learning? One of the reasons is accountability. So we want to know whether or not our program is improving social and emotional learning skills and be accountable to the communities that we work in, as well as the donors, of course. And one of the reasons is so that we can improve our programming to know how much we're improving social emotional skills, what are maybe some of the gaps that we're seeing, what are things that we could emphasize more in programming. One of the other pieces, and we use this data for, is to improve national focus around social and emotional learning skills. In a lot of places, social and emotional learning skills are becoming more integrated into curriculum for children in school. In those cases, we want to be able to influence what we're measuring as well as what is instruction. And then finally, one of the benefits of ISELA, and one of the really interesting aspects of what we're doing, is making sure that we can have cross-country global conversations about social and emotional skills. And given that this is a new adaptation of ISELA, I think we will see that there's some opportunities to better understand what we're measuring of adolescents, of that 10 to 14-year-old age range. All right, any questions on those slides before we move into ISELA? Great. So again,
No,
you'll see
no.
the learning notes in this. Oh, Yusuf, I see you unmuted. Go ahead.
No question.
Okay.
Go ahead.
You'll see these learning notes. And so this is the opportunity to have the printed copies of the ISELA A assessor survey, so that, and that is in the chat, the ISELA A tool, so that the data collectors can go through the tool while you're discussing it. And so if you all can open that file, you can also click through and scan it while we're talking. Is anyone having trouble opening the files that I shared? Silence sounds like you are not having trouble. Are you able to open those files?
Okay, okay.
Great, great, thank you. And so make sure that during the data collector training, you also distribute these in printed form, even though, and in the language that you will be conducting the assessment in. Even though you will be making tweaks to it, you may be, revising some of the wording with the enumerator so that it's more child friendly, but you want to make sure that they have a copy in front of them while you're going through the tool. All right, oops, I clicked too fast. All right, so ISELA A is based off of ISELA. And ISELA, the International Social and Emotional Learning Assessment, aims to measure social and emotional learning skills of 6 to 12-year-olds. So ISELA A is adapted to measure these skills for older children, and it's for 8 to 14-year-olds. So there's not a lot of adaptations, but at the same time, there are different skills that you all are interested in measuring that you have added to the tool during the contextualization process in English. And we'll go through what some of those new sections are that may need further, data analysis, may need some more detailed analysis to understand what we're measuring and what the source of those additional content is. The other thing that ISELA A can do is understand the development differences between, children by age. Oh, it means adolescence, Yusuf. So basically, I wanted to demarcate that this is for older children. So it's ISELA adolescence. Yeah.
Brilliant. Thank you.
Yeah. But you can understand, so you can analyze by gender, by age, you can include socioeconomic status. We'll talk about that in the background section. There's some risk factors, so the exposure to adversity and threats in the environment. And then you can also track change over the longer term to understand how our programming is affecting children. So how ISELA A can be used? It cannot be used for tracking as a formative assessment. So let's say collecting data every week with children, it cannot be used in that purpose. It isn't that quick of a tool in terms of the data analysis, and it is not linked to any specific curriculum, which actually gives us a lot of flexibility because in this case, we're using a different content that we would be using in maybe an education project. It cannot be used for screening either. So we can't say that a child is, this child has weak social and emotional learning skills. It's not an individual assessment. What it is a population level assessment that can be used for situation analysis, for monitoring our programming and making decisions about programming, reporting on indicators, and of course for evaluation. So we can use this for impacts, for outcomes, and to capture variation within the population that we're working with. So this is how ISELA A maps to the CASTLE framework. So the growth mindset section, which is an adaptation within ISELA A and is not in the original ISELA, maps well to self-efficacy and self-confidence skills within self-awareness. We also have a self-concept section that measures accurate self-perception and self-efficacy. We have measures of stress management and perseverance, which measure self-management overall. And then we also have empathy, perspective taking and empathy, which measures social awareness. We have relationships and social skills and communication, which measure relationship skills. And then we have conflict resolution and higher order thinking skills that measure responsible decision making. So social skills and communication, as well as higher order thinking skills and growth mindset, are all new sections within ISELA for this adolescent adaptation. So for ISELA A. All right, so what we're measuring here, we have assent. So of course, this is probably the most important question in the assessment, to make sure that the child agrees to participate. And then we have background questions to understand the child's life, to understand the environment in which they're living. And then we have these domains. So we call them domains: the relationships domain, stress management, empathy, growth mindset, conflict resolution, social skills and communication, that higher order thinking skills, and self-concept. And so we're going to go through each of those domains, and we'll get through as much as we can today, but we probably will not get through the whole tool because it is a lot. All right, so any questions before we start discussing the domains themselves?
Melissa, these data. Hello, can you hear me, Melissa? Hello.
Yes, we can hear you.
I just want to know, it's not a question, that the data will be collected on in a group or individual children.
Great question. So it will be collected individually. So an enumerator will sit with a child and ask them the questions that we will be going through. And we'll talk a little bit more about what that looks like. But yes, it is collected individually.
Okay, thank you.
Ellie, I have a question. How we measure the background using ISELA? Background means
Great question.
what?
Yeah, so background means things like their date of birth, gender, of course, basically the identifiable information that we would want to be using to understand trends. And they are a little bit adaptable. So if some of the background pieces that are in here need to be revised, do consider what you would want to ask for your research questions or for your evaluation questions to understand the population. We'll talk about what has already been adapted for Bangladesh and go through those sections. But yes, there may be additional questions, like disability is not currently included in ISELA, for example.
So question is included related to background, right? Yeah.
Background, or I think it's more like personal information, is it?
Yeah, it's the background of the child.
Yeah. Thank you so much, Ellie. Thank you so much.
I have a question.
Yes, please
What will be the number of collecting data?
What will be the sample?
Yeah.
I actually don't know. So we do need to talk about that more. In the research protocol that I've seen, I'm not 100% sure on what the sample looks like.
Sure.
Mubashir bhai or me, I will let you update later, okay? How many sample size will be
Thank you.
conducted?
Yeah, and we should discuss that as a group because we need to sample from the whole population that you all are working in. We're not going to assess every child that you all are working with. So we'll need to sample from that whole population figure. So if I don't know, Melissa, if we're going to do that together or if you all are going to do that separately, but we can discuss it more. I had anticipated that on Wednesday we would talk about the data collection plan and sampling.
Yeah, I think it would be good to discuss it as a group. We do have our traditional way that we do the sample size calculation, so we can talk about that, but would also be open and welcome any suggestions you have, Allie, about that. And it's helpful to have this group because we can talk about, you know, how we can make sure the sample includes children and adolescents from all the different partners that we work with. We have a mix of children who are in school and out of school. So yeah, I think that would be great if we can talk about that on Wednesday.
It will be determined later.
Yes, to be determined.
Okay.
All right, so let's dive in. So this is the assent section. And again, this slide is for your notes, just to be prepared for the training with the data collectors. The important thing here is that the data collectors have a copy of the child safeguarding policy, Save the Children safeguarding policy, as well as if you have organizational safeguarding focal points. The enumerators need to know who the safeguarding focal points are in case something comes up during data collection. And so we really want to ensure that the data collectors understand the safeguarding policy and procedures, and the relationship between that and assent, to understand the data collection and make sure that we're protecting children. All right, so I don't know the safeguarding policies. So this is where you would insert that. You would have a presentation from your safeguarding focal point with the data collectors. All right. So assent. The important part here is that enumerators and data collectors understand that children are volunteers and that they have a choice to participate. They are not required to participate in this assessment, even if we've decided that they should be part of our sample. If the child does not participate, they can that there will be no penalty. They will, it will not affect them negatively in any way. They should be provided with enough information about the research and confirm that they understand the information. And they should be treated as capable of making this decision for themselves. Children that are not able to make this decision for themselves should be protected and acknowledge that they're not able to make this decision. If they're not able to, that means they are not assenting. But yeah, we just want to make sure that data collectors are not pressuring children to participate in this. And again, any of you who've done data collection with children, I'm sure this is a review, but just really emphasize it with the data collectors. And then if you are providing, let's say you're providing a refreshment to children who participate in the assessment. If a child refuses, they should still receive the refreshment. So again, there should not be a penalty for them not participating. So child assent is the process of getting providing the information to the child about what the survey is, what data we're collecting, and asking them if they want to participate. We should receive permission from the parent or caregiver prior to starting data collection. And this can be challenging, I know, but if you have received permission for data collection from Skills to Succeed participants, that may be enough, but you want to make sure that you've checked the boxes here and made sure that the parents know, or caregivers know, that their child will be participating in this assessment, and that they agree to allow their child to participate in this assessment. But even if we receive the parent and caregiver participation, we still need to confirm with the child if they want to participate. So if the parent says no, that's the big person here on the right, we do not talk to the child about the survey at all. If the parent says yes, then we let, but the child says no, then we let the child return to the classroom or the community center or wherever it is. We do not continue the survey. So even if the caregiver agrees, we do, but the child doesn't, we do not continue the survey. Only if the caregiver and the child both agree to participate, then we continue the assessment.
Okay.
Yeah, again, this is probably a review. And it is totally okay if the child does not want to participate in the assessment. And the other thing that's important with assent is that the child can stop the survey at any time or skip any question that they want. So if they, don't feel comfortable responding to a question, if they are, tired and want to stop, if they need to go to the bathroom and don't want to continue, they can stop the assessment at any time. And they need to understand that. And that you'll see is in the assent statement as well. The other thing that's important here is that we do not want to share the information that the child tells us with anyone else, including the caregiver. Now, the only caveat here is if the child reports abuse or neglect, this goes back to the safeguarding issues. So that may come up, and the enumerators need to know what the safeguarding policies are within the organization, within the Save Bangladesh, and who to refer children to. Yeah, and so this is the what you would do if a child reports that they're hurting themselves or is being hurt by someone else. All right, so the information that we collect prior to assent, we enter in this information, and so this is beginning to talk about the background information, Yusuf, that you were asking about. Yes, and Yusuf, again, one of the reasons that I emphasize this a lot here is that the data collectors really need to understand children's assent is, priority number one in doing any data collection with children. But this information is background information that we would enter in prior to actually collecting the data with the child. And this has been reviewed by the Save the Children Bangladesh team. So we would include like the assessor's name, the assessor's role, and we will talk more about this as we go forward. But basically, most of the time, the assessor will be working alone, conducting the assessment by themselves. So that would be coded as a 1. There are 10% of the sample should be assessed in pairs. So this is called inter-rater reliability. It helps us know if the data is being reliably collected between different assessors. And again, we will talk about this more, but that would be when they would mark listening only. So if they are working in a pair and one is speaking and the other is only listening and writing in the responses, and then we compare the responses and the analysis. So that's when they would code listening only. Again, we will go into that more. Data collectors may not be used to that. It is very important, especially because this is the first use of the adolescence adaptation of ISELA. We want to make sure that we're reliably collecting data. And that means that our data is consistent between data collectors. Also the school or center name. So this would be pre-populated. We will need to get that list of names from you all and an ID that we've generated for those centers. That one may not be necessary. We can generate that later, but just it can be useful. The teacher facilitator's name, again, this has been reviewed. If you do not need to collect that information, you can remove it. And then the child's grade or class. Now that can be really useful since as you're talking about, grades 5 through 8, we would anticipate that older children would have, in the higher grades, would have higher social and emotional learning skills or stronger social and emotional learning skills, but we may not see that. And so that's an important question to collect. We also have the child's full name here. Now, this is a consideration for the ethics. So collecting the child's full name is really useful for tracking children over the course of a project. However, it is personal identifiable information. And so that needs to be very carefully handled. As well as you need to consider, how it's being stored, all of that, so that we're not risking having the child's name being shared with people, broadly. The child ID is essential. So the child ID is used for, here you go. is used to track the individual child over the course of the intervention. So making sure that the child ID matches what is used in the baseline, at endline, or any other surveys or data collection tools that you're using. So let's say that you are using a tool to track participation, like attendance in the program, then you would want to use the same ID that you're using for that here, because then you can connect that data. And then, is the child a refugee, an IDP, from this from an ethnic group, a migrant, none of the above, or other? These have been adapted by the Save the Children Bangladesh tool, team. But the question to you all, as representatives of partners, is, do these categories make sense in your context? And if they don't, we can remove them. So if there's no refugees in your population, then we wouldn't include that. Does anyone have any questions? Yeah, Yusuf, go ahead.
Yes, I have a question related to A11. Is the children yes or no? If I ask to the children, is the children, then how I will ask question to our participant? Please describe. It's very difficult to me. How will
Yeah.
ask?
No, it's a great
Yes.
question. So ideally, you would have this information already before you even sit with the child. So you
Yeah.
wouldn't even be asking this question to the child. You would be identifying the child prior to actually meeting with them as, a member of one of these groups. If you do not have that information, then you would have to ask the child if they are a refugee or an IDP or a member of an ethnic group or migrant. And I leave this up to you to decide how best to collect this information, because I don't know the context. But you could move this down into the background section so that you were able to collect this information directly from the child.
Yeah. Thank you so much.
Yeah.
Thank you.
But Yusuf bhai, related to these questions, it will be difficult to collect the information from the child, whether he or she may not be know whether he or she is a refugee or international, and this question maybe it will be difficult for the child to answer.
Already give the answer, Ellie. It is a background of the children, so we need not to ask the children, are you refugee, are you ethnic group? So we should have data primarily in our office or in our hand, right?
Yeah, according to us.
Yeah, exactly. It should be, ideally, you would not ask the child this. You should already have this information.
Right. Thank you so much.
Thank you.
Yeah. And if you don't, I think we could put a don't know in the none of the above so that it would
Right.
be an option.
Yeah.
Yeah.
Yes, it would be good for us.
Great. All right, so here's the assent statement. Now, what's really important in the assent is that the enumerator, the data collector, reads this exactly as it appears. We want to be asking this question exactly the same way to every child. And you'll see here your organizations are listed. These, obviously, if you work for CPD, you would say, I work with CPD. I work with, what is it, Beta? Beta, you would say that. And then you would, under partnership agreement with Save the Children. It may be important to say these out rather than the acronym so the child fully understands what organization is being presented. This was the adaptation from the team. I don't know what all these acronyms mean. And then we're trying to learn more about the relationships that you have in your life and how you feel about different situations. This is not a test. That is very important for the enumerators to say. Do not worry if you cannot answer some of the questions. I just want you to try your best. I would like your help, but you do not have to take part if you do not want to. You can stop and take a break at any time. You can skip any game or question that you do not want to answer. You can also end the survey at any time and return to your classroom or center. All the answers you give me will stay between the two of us. No one will know what you have told me. Do you have any questions? So that gives an opportunity for the child to ask any questions, to clarify what they're agreeing to. And especially for older children, they may want to know, more about what the data will be used for and things like that. So enumerators should be prepared to answer any questions from the child. And then it says, will you do these activities with me? That is incorrect. So let me check, sorry. Let me check the version that I shared with you. It looks like this version has not been updated. It should be, actually, no, that's right. Will you do these activities with me? No, that is right. Sorry. We changed it from will you help me to will you do these activities with me? So it's not leading. Now, if the child, yeah, so this is important. They need to read the script exactly as it appears and memorize it if possible. So ideally, that's one of the reasons we practice so frequently, is that the more we practice, the more the data collectors will be confident in the wording and say it exactly as it appears. If the child does not agree, if they say no, if they stay quiet, then, allow them to go back, let the teacher or facilitator know if they seem unwell. Do not try to re-administer the survey to any child who has refused once. So if the child says no, or if they, stay quiet, then you say, okay, that's fine. You don't continue. So again, this is a useful discussion to have with the enumerators about issues that might come up when asking the child for their assent. And so you can think about on your own what issues may come up. And then if you have any questions or comments that you would like to put in the chat, please feel free. But this is a discussion question to have with the data collectors. So as a TOT, we're not going to do all of these group discussions because it will take far too long to go through the entire slide deck. All right, so any questions on the assent before we move on to the background questions?
No, it's clear to me.
Great, great. Yeah, and again, just emphasize this with the data collectors because it is the most important question in the assessment. If the child does not agree to assent, and does not understand what they're agreeing to, then it is not, not okay. All right, background questions. So Yusuf, this may answer some of the questions that you had earlier. So we would want the enumerators to understand what the background questions are. And then we would also want to, you'll see some of the sections need to be contextualized. Okay, so we're focusing here on the background section. So the information that we collect here, we ask the child how old they are in years. If the child does not answer, we would put, I don't know, 999. The child may not know their full date of birth, and that's fine. We would again put the 999 if the child does not know. For older children, they likely will know, but for the younger children, they may not know the full date of birth. Then you can see the languages spoken at home have already been contextualized. So this would be Bangla, Hindi, Urdu, or other. Now, again, ideally, the mother tongue would be used in the data collection. So that means that ideally, you would translate the entire assessment into Bangla, Hindi, and Urdu, which is a lot. But think about what languages the children are likely to know and speak at home in your assessment, and then translate accordingly. So your sample, maybe all of the children speak Bangla. your sample, maybe all of the children speak Hindi, in which case you would want to have the tool translated into both. Does that make sense?
Yes.
Okay, great. This question, does your house have? This is actually measuring socioeconomic status. So we're trying to understand if children are in households that have, a lot of these items. So the first three here should be the most common items that almost all households would have. And these again have already been reviewed by the SC Bangladesh team. That does not mean though that they cannot be further reviewed. Then the next four items would be the average household. So most households, but not all households, might have a television, a telephone, refrigerator, or bicycle, for example. And then these items should be the most, the wealthiest households would have these. So like a motorcycle, a computer, a car, or van, only the wealthiest households would have those. Now, again, we can revise these items. So if you see these and you think, okay, this is not exactly what the most common items would be, we can revise this. So how does this look to you all as common, average, and only the wealthiest households? Is this accurate? I will take silence as yes. Again, you can review this though further. All right. So here is a discussion to have with the data collectors. This is also a time that you can revise that list of the common household items, and then you can make tweaks to this. All right, so the background section continues with what we call risk questions. And these questions, these questions can also be contextualized. If you're concerned about child safeguarding issues, you can remove some of these questions. We've had teams actually remove this whole section because they didn't feel safe asking the children about these sorts of sensitive questions. You need to, as a team, consider which of these questions are most appropriate. Or if all of these questions can be included, then you'll get a lot of information, but you may not be able to include all of them. Please do consider that safeguarding concern. But the background questions that we have in here are about child labor, if the child has had to work to earn money, especially given that you're assessing up to 14-year-olds. I mean, I started working at 14 in the US. So I think that there's a chance that there's a good chance that you'll have actually a high number of children who've had to work to earn money to support their family. Have you had to miss school for longer than a month? Have you had to leave your home because it was not safe? So for displaced children, this may be a common experience. Have you ever lived in a community where you did not feel safe? And again, these questions are written in a way to not ask them currently if they're experiencing these. They're asking if this has ever occurred. And so that's an important differentiation here to make sure that this is asking, have you ever, not like, do you currently? So when you're looking at the translation, make sure that that is in there. And then we get into, again, more sensitive questions about, have you ever lived in a home where people shout or yell at each other? Have you ever lived in a home where people push, slap, or throw something at each other? Have you ever gone hungry because there was not enough food to eat? And then has anyone in your family been away from home for more than 6 months? So the questions about shouting or yelling, pushing, slapping, or throwing, you need to, again, consider at the safeguarding side, the child protection side, what this information will mean. But these risk factors are really important when we're thinking about children's social and emotional skills. So do consider keeping them in, but also consider the safeguarding concerns. All right. Any questions on the background questions that we collect?
Anyone, any question? Sorry, I was out of connection few minutes due to unavailable electricity actually. So anyone have any question before starting background information?
No, no
I
question.
am really requesting, especially our M&E officer, to raise any sort of concern or question, because you are the right person to for this research. So please
There
feel
is no
free to ask any
inappropriate question. All are appropriate, I think.
Okay, thank you.
Thank you. Thank you.
Great. And again, this is going to give you very good data about children's experiences that might be affecting not only their social and emotional skills, but also their participation in the program. If the child is working, they may not be able to be participating fully, for example. Okay. And then you can also add other risk factors that you may consider important that are not included in those questions. All right, so the relationship section, moving right along. So this one, again, we want to have the data collectors referring to that Word document I shared in the chat. Yusuf, totally understand the connectivity issues. I think we've all experienced those, but glad that you're able to connect again. And then this section is also, you know, we want to make sure that the enumerators understand how to ask these questions. All right. So what we're measuring with the relationship section. So we're measuring their child's use of social supports. Are they able to identify, you know, peers like friends and adults in their community, in their household? Who can support their experiences, and can they use these networks for their own, you know, to solve problems and understand their networks. We also ask questions about how many people are in these networks. So the size of the child's network and seclusion. So maybe there are children who do not have any access to people who can support them to solve problems or to support them, their feelings. So this is why this competency is included. And so you can see the questions here. So who do you live with is that size question. So we're asking then the size of their household. Now, children who may have, you know, a household that's dispersed, maybe they, you know, have parents that are separated and they have two households. So we're asking really the primary household that they live in, who the number of people who live in that household. And then we ask questions, do you talk to anyone at home when you are sad? Now, one of the things I'll point out now and reiterate later is just like the assent, we want to be asking these questions the same way to every child. So this is, again, why the enumerators need to practice this tool as much as possible, and you all should be confident in knowing what the questions are and what they're asking. Because we don't want one child to be asked a question and another child to be asked a different question. We want them all to be asked the same question. So again, do you talk to anyone at home when you are sad? This gives us information about children's empathy, children's use of their social networks, use of supports. And then we ask another question, which is a little bit more complicated, but also gives us more information about their social network. Do you talk to anyone else? So maybe they talk to one person at home when they're sad, but they don't have anyone else at home that they can talk to. Like they can talk to their mother, but they can't talk to their father about that. And we don't need to know who they talk to. We just need to know if they talk to anyone at home when they are sad. And then anyone else at home when they are sad. Now you can see the skip pattern here on the side. If the child does not live with anyone, like let's say they live on their own, this may not be common in your sample, but then you would skip the next questions. If the child does not talk to anyone at home when they are sad, then you don't ask them if they talk to anyone else at home. Now, what's useful is the Kobo link that I shared above actually already includes all of this skip. So you can see as you move through the Kobo form that if the child says no, or I don't know, or they stay quiet and they don't answer this question, you can skip the next question. And that actually shortens the assessment for children who are younger, or maybe not able to respond to some questions. So then we keep going. Do you ask anyone at home for help when you have a problem with a friend? So again, this is giving us information about the child's use of their social supports. And then we ask the more complex question of they to ask anyone else at home for help when they have a problem with a friend. Then we do, if you are working on something difficult, do you ask anyone at home for help? Again, we're talking about the use of their social supports. And if you're working on something difficult, do you ask anyone else at home for help? And make sure the enumerators understand that when we're asking anyone else, we're asking a more complicated question. And then, do you know when someone in your home is feeling sad? So this is actually an empathy question. This is telling us if the child can identify the feelings of someone else in their family. Oh, and this is important. If the child, when you're counting who they live with, the enumerator should have a marking system. Either they're like writing on a piece of paper and tallying up, or they're using their fingers as the child is as listing people. Then they can track the number that way. If the child says, I don't have problems with friends or something like that, then you would mark no. And if the child starts giving an example in any of these cases, then you could mark yes. All right. So then we continue in the relationship section. And so the first section is about the household. The second section is about their friends. Sorry. So if they don't list any friends, can you tell me the names of your good friends? And they stay quiet, they don't, they don't want to share this information, then you would just put 0 and you would skip the rest of the questions. So one of the things that's important, we haven't talked about, but is very important for the enumerators, is rapport building. So we want to make sure that children feel comfortable in telling this information to this adult who they don't know. And so one of the things that's really important to work with the data collectors is making sure that they can build rapport with the children, and the child can feel comfortable with them. That might mean playing a game with them. It might mean, just getting to know them at the beginning, asking them questions about themselves, just making sure that the child is comfortable with them even before they ask the assent, so that the child's not nervous talking to this adult who they do not know. And then moving on through the relationship section, we ask another section about other adults in their community, in their school, the adults that they talk to. So this could be teachers, it could be other people in the community, religious leaders, things like that they would talk to outside the home, even neighbors. If they, you ask them then, do you talk to any adult in your center or school when you are sad? So this could be if they say like in school, you can be, it can be anywhere, not just in school. So maybe they talk to a neighbor or a family friend, or again, a religious leader. And then do you ask any adults in your center or school or community for help when you have problems with a friend? So again, all of these questions mirror each other and are measuring similar uses of social support or empathy. So one of the important things in the translation, and we don't have the translation yet, is making sure that translation captures the meaning of the concepts like sad, problem, help, difficult, or feeling. Those questions, can have different meanings. Problem, for example, could be referring to like a math problem, or it could be referring to like a fight. So you want to just make sure that those translations are clear when you have the translated material. All right, any questions on the relationship section before we move to stress management? I am moving through this pretty quickly, so please interrupt me as we go.
No question.
Yes, please go ahead. Oh, you said no questions. Sorry. Nazma, did you have something?
No, it's okay. It's clear, very clear to me.
Fabulous. Okay. And
Thank
again, for those of you who are staying quiet, I have a few people here who are very vocal. For those of you staying quiet, that's fine, but please do feel free to ask any questions in the chat or raise your hand or come off mute.
Yeah, sure.
Great. All right, moving into stress management. So this section, we'll be going through the stress management subtask. And what we're measuring in stress management is the use of skills and resources to deal with the impact of stress or these risks that we've been talking about at the beginning. So what are the strategies that children use to control their stress, especially chronic stresses that they may face? And that ideally we would be able to improve that stress management through their participation in the program. So one of the discussion activities we have here with the data collectors is to think about appropriate or inappropriate ways that children can handle stress. So when they're feeling angry or upset. And given that I've been talking a lot, let's take a little moment to answer these questions for our context. So can you provide me with some examples of ways that children respond when they're angry or upset in this context?
Nazma,
Yes.
please give the answer. What is the appropriate things when children
When children
angry and upset?
and they try to count reverse like 100, 90, 99. That's why they can reduce their angriness. And in our module, there is a game like that. So this is a common thing that when a child gets angry and upset, and they can do this. They can practice this counting. So this is one of the method they can reduce their angriness.
Yeah, it's
Reverse
our project
counting.
communicating, right?
Reverse
But
counting.
in our personal life, when we offering chocolate, then children become happy.
Happy.
Yeah.
And when they demand something, if we can, like in our CLC, they when they can't, when we didn't allow to use the internet right this time, they can get angry. After when we give them access to get the internet, and they want to make a picture, draw a picture, on, or they can when they can that time they can become angry. They reduce their angriness. So different children have different um, uh, uh, view to reduce the angriness.
Exactly. So I just wrote these down, count backwards from 100, eat chocolate, draw a picture. So thinking about these as examples, I think these are great examples. Which of these are appropriate or inappropriate responses? Would you say these are all appropriate responses to stress?
Yes.
Okay. I'm not sure in my context if eating chocolate would be an appropriate response to stress, but if it
Yes,
is in your context, then definitely include it as an appropriate thing that a child could do. What about inappropriate? What are some negative ways that children cope with anger or being upset?
One of the negative not not behave well with them. This is this. I think there's the
Sometimes parents were shouting
Yes.
is a quite inappropriate thing to reduce the children angriness or upsetness. So it is the most common thing in our country happened. So I think this is not should be happening.
One of the inappropriate system, because children have to share something, whether children wants to have something to share with the parents, but parents is not listening them. So this is also a inappropriate system for the children to reduce the angriness.
Sorry, what I got from that was like shouting or getting angry with their parents would be inappropriate things that children could do when they're angry or upset. I think these are also great examples. And you can also think, if you have children, what are some of the appropriate and inappropriate things your own children do to cope when they're angry or upset? These things, you can think about in terms of children that you interact with. And the enumerators can also think of, like, in their community examples. Great. So those are the questions within stress management. So we say, now I want to ask you some questions about what you do when you get angry or upset. And again, we say that all the same way to each child. Can you tell me one thing you do to calm down when you get angry or upset? And if it's unclear, you can then ask, this is a probe. How or why does this help you calm down? Now, if they are unable to answer this question, you skip the rest of the questions. If they are able to answer this question, you ask them, is there another thing that you could do to calm down when you're angry or upset? Again, this is a harder question because maybe they can think of the counting, but they don't think of another one. And then we ask again, is there anything else you do? So again, that's even more complicated. Now they have to think of 3 ways that they can calm down when they're angry or upset. And then think about the contextualization in the translation as well. Make sure that angry or upset are appropriate, like a terminology in your context. Calm down. Also, you want to make sure that the translation is child friendly. And these prompts that are in here should only be used if the answer is unclear. So you wouldn't ask this if you understand what the child is saying. All right, and so with the enumerators, we just did this together, but with the enumerators, you can actually generate the appropriate and inappropriate responses. So you already have some examples that you know would be appropriate and inappropriate. So you can give them those as examples and then tailor it with them if there are other things that they can think of. One of the things that's really important here is to think of basically all of the possible things that a child could do. And so I have some examples here that we've used from other contexts. The counting is here, but it's counting to 10. And so your example of counting backwards from 100, which I actually do that, I count backwards from 1,000 to fall asleep. So it's funny that you use it as a stress management. But counting backwards, you could add, right, as an appropriate response. Eating chocolate, you could add. Drawing a picture, you could add. Some of the other examples here are doing breathing, taking deep breaths, shaking things out, stretching, getting water, going for a run, listening to music, meditating. That might not be appropriate in context for this age range, but maybe it is. Singing, thinking about something happy or imagining yourself playing a game and talking to someone. That can be another example. Again, examples, these, you would not use these. These are examples for you to consider. Yelling, we have here, screaming, smoking, drinking. For older children, they may say those things. Punching something, making fun of someone or finding someone to tease, throwing something, throwing stones at pigeons is an example here, but like throwing things, or I don't know. I don't know would be an appropriate response here. Because they do not know, I mean, an inappropriate response here because they do not know how to calm down. All right, any questions on stress management before we are going to take a 10-minute break?
Thank you. Clear.
Okay. Great. Yeah, so what you're seeing though is that unlike a lot of the data collection that we do, we are not recording the child's actual responses. We're recording whether or not these are appropriate or inappropriate responses to the question that we're asking or the scenario that we're posing. So that's really important for the data collectors to understand because they may have collected data for you in the past, but this requires them to think about what are these appropriate and inappropriate responses and code accordingly, but not judging. We're not judging their responses. If it's inappropriate, we just mark it as incorrect, do not know, and move on. So we're not trying to judge the child here. All right, let's take a 10-minute break. Sorry for those who have joined late or having connectivity issues. We are recording this, so you can go back and review the sections that you may have missed. But let's take a 10-minute break, and then we will come back together. Does anyone have any questions before we break? Great. We are moving through this really quickly, so please do ask any questions that come up, and we will continue to review the tool after break. All right, thank you. I will see you all in 10 minutes.
Okay, thank you very much.
Okay, thank you very much.
All right, we are coming back. I'm going to give you another minute to get back in case I know it's quite late, so in case you're getting tea or something to keep yourself alert, please do so. And thank you again all for joining so late your time. All right, Yusuf, I see you're back. Great. All right, back. Let me share my screen again. All right. So we are moving to the empathy section. Again, I'm giving you a little bit of time here to come back. What we've gone over so far is assent and background. Yes. Obaidullah, you're back as well. Great. We've also gone over the relationships and the stress management sections. Does anyone have any questions or comments on those sections that you would like to discuss as we are all coming back?
No, thank you.
Okay, great. Again, we have an hour and a half together remaining. For those of you who can stay on, please do. I am aware of the time, so thank you again for spending your evening with us. But we're going to move to the empathy section. I have empathy for you and your time zone. For me, it's early in the morning, but not too early. Disha?
Yeah, Disha, I'm Disha.
Okay. All right, so the empathy section is measuring our awareness and understanding of emotions of others. And we're also measuring the ability to take the perspective of others and understand their reactions and also think of socially desirable interactions, basically. So the empathy section involves some child materials or some materials that we would show the child when we are doing the data collection. And the questions that we ask, we show a picture of a crying child. A tear must be visible. And so you'll see some examples here that we've used in previous contexts. This picture should be contextually relevant. So I did a quick search to try to find a picture of a crying child in Bangladesh. I was not able to. So if you have a picture or want to do some further searching for a more appropriate picture, please feel free. You can also use one of these images. So we have two cartoon images of a girl and two images of a boy. And again, I tried to find pictures of 8 to 14-year-olds, but it was quite difficult. So the questions that we ask are about how the child is feeling, what that you would do to help this child feel better, and if there's anything else you would do. So again, we're thinking of appropriate or inappropriate, contextually relevant responses. And so again, here I have highlighted that you need to identify a culturally and age-appropriate picture of a child with visible tears. Again, you want those visible tears to be there. If you are unable to, again, feel free to use these images or one of these images. So if let's say we're using this picture of a crying girl, so the data that we collect is, let's look at this picture. How do you think this child is feeling right now? Now, if the child responds like they're crying, then you would repeat the question, because what we're asking is not an action. We're not asking what the child is doing. We're asking how the child is feeling. So we're looking for a feeling word. If they answer with a feeling word like sad, upset, even angry, then that would be marked as correct. So we'll talk a little bit more about appropriate and inappropriate responses, because again, just like stress management, we need to make sure that these are contextually relevant, appropriate and inappropriate responses. Not necessarily the same that we would use in Iraq or Jordan or, any Colombia, any other context that we use this tool. We want to make sure that these are the responses that are appropriate and inappropriate for your population. And then we ask, what would you do to help her or him feel better? So if it's a picture of a girl, you would say her. If it's a picture of a boy, you would say him. And if the answer is unclear, there's a prompt. So again, we only use these prompts if the answer is unclear. And then we ask a more complicated question. Is there anything else you would do? So asking them to think of something else that they could do to help the child feel better. So again, we won't spend too much time on this group discussion. We'll move through this, but think about appropriate things that children can do to make another child feel better. And again, think about age appropriate as well. And then think of inappropriate things that the child could do to make the girl or boy feel better. And so with the enumerators, you would write down what some of these appropriate responses would be. And we do have some examples, but I'm going to go through the whole empathy section first before we go through the examples, or this section of the empathy section, because then we have a story. So now we say a story about this child and why they're crying. One day, the teacher or the facilitator told all the children in the center or the classroom to make a line so that they could go out to play. All the children rushed to make a line. As they were making the line, another child bumped into this girl or this boy, and they fell down and hurt their knee. That is why they're crying in this picture. So the question is, why did the other child bump into this girl or boy while making a line? So what we're measuring with this question is actually non-hostile attribution. So what would, let me hear some possible responses from you all. Could you provide some responses in the chat or unmute about what are some reasons why would this other child bump into the girl or boy while making the line? Great, Mobasharul? I might be saying that wrong. Mobasharul.
Yes,
Apologies.
yes.
Oh, I'm saying it correctly. Great, thank you. Making a competition on who will go first. That is a great example. Now, that example is actually an inappropriate response. It would be marked as inappropriate. The reason being is that is a hostile attribution. We're assuming that the other child intended to bump into this girl or boy and in order to get in front. And as adults, honestly, the first time I answered this question, I thought, well, they're a bully, and they just wanted to get ahead and they weren't paying attention. I thought the same thing. And that's a hostile attribution. And as adults, we have learned to attribute hostility to other people's actions. An appropriate response would be a non-hostile response. So maybe it was an accident. They didn't see the girl. Anything that would be implying that they did not intend to get ahead, to push the child, that they were just, on accident bumped into this child. So that would be an appropriate non-hostile response. So this one is very important to talk about with the enumerators, because again, as adults, we are going to jump to hostile attribution and think that that is an appropriate response, because that as adults, we've learned to attribute hostility to other people. We're hoping that children haven't learned that they're not attributing hostility immediately to another person's actions. And then the next question is, how do you think that the other child felt after this girl started crying? And this is a complex question, right? We're asking them to think about another child's feelings in a more complex situation than the first section. And so here there's a question about what is the difference between a hostile and a non-hostile response. So again, you would then come up with some appropriate and inappropriate responses. Again, the non-hostile response would be appropriate for that first question, and the hostile responses would be inappropriate. So here are the examples we have. And again, these are examples. They are not intended for you to use them, but for you to start thinking about what these appropriate and inappropriate responses might be. So for that first question about how do you think this child is feeling when you show them the picture of the crying child? You know, sad, upset, hurt, in pain. These are all, oh, great question. These are all, let me finish this thought, and then Yusuf, I'll get to your question. These are all feeling words. An inappropriate response would be don't know, or an inappropriate response could be, you know, crying or an action or staying quiet. So Yusuf's question in the chat is, what is the difference between sympathy and empathy? Empathy is the feeling about others, and sympathy is helping when anyone is feeling sad or happy, right? So empathy is taking and is understanding the feelings of another person. And again, the trying to put yourself in that other person's perspective. So that's what we're talking about in terms of empathy. Sympathy is potentially like feeling bad when another person feels bad. And so we're not actually asking questions about sympathy. It's not actually asking questions about how do you feel about this child crying, for example. We're asking, how does that child feel? So we're asking them to put themselves in the perspective of that other child. Does that make sense?
Yes.
Yeah. Yeah, and that, again, these are great questions, and they will come up with enumerators too. So think about what are some of the questions that might come up from enumerators, and feel free to ask those so that you're prepared to respond to questions that come up during the data collection training. All right, so for the first section of potential appropriate and inappropriate responses, what would you do to make this child feel better? So we're asking, what would you do to help this child feel better? And is there anything else that you would do? So some examples that we have here, and again, these are not contextualized for your environment, but is to give her a hug, maybe to tell an adult, to ask them what is wrong, talk to her, bring her a glass of water, you know, tell her a joke, try to help her laugh. And in some of these contexts, like if you're interviewing a boy, it may not be appropriate for him to give a girl a hug to help her feel better. So think about also the gendered components of what is an appropriate and inappropriate response to these questions. Inappropriate responses to what would you do to help this child feel better? They could be examples like ignore them, do nothing, run away, like avoid the situation, make fun of her. Or I don't know, you know, like if they don't know how they would help this child feel better, you would mark that as inappropriate or incorrect. For that hostile attribution question, so why did the child push the other child? The non-hostile response would be it was a mistake, they didn't see her, maybe the other child was pushed by somebody else, so it was like a domino effect, or the other child tripped and just ran into the girl who fell down. A hostile response would be the example that Mobashirul put in the chat, that the other child wanted to get ahead, that they did not like her, that they were a bully, or of course that they didn't, that the respondent doesn't know why that would have happened. And then how do you think that this other child felt when the girl started crying? So, you know, we were looking for appropriate responses, could be bad, guilty, or sorry. Inappropriate responses would be happy, laughing, pleased, or they don't know, or maybe they don't think the other child would have felt anything. So again, all of these are examples for you to contextualize in your context. So do not feel like you have to use this list. Generate a list with enumerators, and that also gives you a chance to practice what would be appropriate and inappropriate responses in context. All right. Any questions on that section? Because there's another part of empathy that we're going to continue talking about. Okay. The second part of the empathy section is a picture of an angry child. So it's the same structure as the first section, but it's about a different emotion. So I have some examples here of pictures of angry children. I could not find examples of a picture of an angry girl, which is interesting. But I did find examples of a picture of an angry boy. And you can, again, use any of these. You would use the same one throughout, or identify a culturally appropriate picture, an age-appropriate picture for your context. So consider what would be an appropriate picture of an angry child. And we ask the same questions. How do you think this child is feeling right now? So the data collector shows the image to the child and asks them, how do you think this child is feeling right now? And then asks, what would you do to help him calm down? And then, is there anything else you would do to help him calm down? So you see, it's the same structure as the crying child picture. So the angry child versus the crying child. So what data do we collect? You can see here those questions I just went over, and you mark them as a correct and incorrect, or you could also think of that as appropriate or inappropriate. And we have the same skip pattern we had in the first section. And there are probes here in case the answer is unclear, but again, you would only ask those probes if the answer is unclear. So we could then think about, with the data collectors, appropriate and inappropriate ways that children can do to help this boy calm down. So you would think about different examples and brainstorm those with the enumerators so that they also have the same understanding of what appropriate and inappropriate responses would be. Again, I will show you examples at the end here. Then again, we have the same structure as the crying child. We tell a story. So this is about this boy and why he is angry. He's just finished a beautiful drawing for school. He worked on it for a long time and is really proud of it. Another child came over to look at the drawing. This other child was holding a glass of water. The boy turned away for a minute, and when he looked back, the other child had spilled water all over his drawing. That is why he's angry. So we have, again, the hostile attribution question. Why did the other child spill the water all over the drawing? And so what we're looking for here is a non-hostile response. So again, just like our example in the first section, we basically want to know if the child we're asking can identify a non-hostile response, which means a response that's not attributing hostility to the child who spilled the water. So it was an accident is a great example of a non-hostile response that would be appropriate. An inappropriate response would be, they were jealous of the picture, they don't like the boy, or something like that. And then again, there's that more complex question about how do you think the other child felt when the boy got angry? And so I'll give you some examples of appropriate responses, like they might have felt scared, they might have felt upset, they might have felt sad, they might have felt sorry. And inappropriate responses would be like, they didn't feel anything, I don't know, they felt happy, things like that. So, yeah, Nazma?
Yes. I the same feelings of mine that children are very happy to dropping the water on the drawing. So this is the hostile behavior. So it's not the appropriate approach.
Exactly. So if the other child felt happy when the boy got angry after they spilled the water, then that would be an inappropriate response. Exactly. And so you would brainstorm with data collectors some example of non-hostile and hostile responses and appropriate and inappropriate responses to how the other child felt. So here are some examples. Again, please contextualize these. So how do you think this child is feeling after you show him the picture? Angry, upset, mad, frustrated. Those would be appropriate responses. I don't know, or any like happy, or this child feels nothing. Those would be inappropriate responses to the picture of the angry child. The second question's there about what would you do to help this child feel better or calm down? These are just examples. Again, like giving him a hug might not be appropriate if it's a girl child that you're interviewing in your context. So consider appropriate and inappropriate questions here, or responses here. Tell an adult, ask them what's wrong, talk to him. Those would be appropriate examples of appropriate responses to an angry child. Bring them water, tell them a joke. Again, appropriate responses to an angry child. Inappropriate responses would be like ignore him, run away, make fun of him, not do anything, I don't know. Again, these would need to be reviewed by the team and the data collectors. When we get to the hostile responses, the main non-hostile response is it was a mistake. But the child who spilled the water could also have been bumped by someone. It was an accident and somebody bumped them and they spilled the water. They could have tripped. So again, these are very similar to the first section, but focusing on, you know, the story of the spilling the water. A hostile response would be like the other child didn't like the drawing. They were jealous of the drawing, didn't like the boy who did the drawing. The other child is just a bully. So those would be hostile responses. Basically, they're attributing that the boy intended to spill the water, or that the other child intended to spill the water on the boy's drawing. And then how do you think the other child felt? Again, the example that Nazma gave would be inappropriate. They felt happy, they felt pleased, they didn't feel anything. They don't know how the other child felt, or they felt bad, they felt guilty, they felt sorry, they felt scared that the boy got angry. Those would be appropriate responses. So again, think about what appropriate and inappropriate responses would be to each of these questions. And you can have these conversations with the data collectors. That's why these slides are here with these big empty boxes, so that you can add contextually relevant, appropriate and inappropriate responses. All right, any questions on empathy before we move to growth mindset?
Yeah, Ali, just back to first slide of empathy.
This one or the crying child?
Another back.
This one?
This go another go.
Maybe next one.
Yes, this one.
This there is a question question slide. The next one.
Next one.
This question. This slide.
Yeah. Then next one.
This one.
Yeah. I ask regarding E2 question, the second question. What would you do to help her or him feel better? This is a question, but what type of answer we expect from the respondent?
A great question. So you want to think about what is an appropriate and inappropriate things that the child could respond. So what would be an appropriate way to help this crying child feel better in your context? I give some examples, but those might not be relevant. So like give her a hug might be an example. Talk to her could be an example. Ask her what's wrong. You know, give her chocolate, give her a treat, give her get her some water. Those would all be appropriate responses, but it is contextual. So what do you think are ways that are appropriate to help a crying child feel better?
Okay. Okay, that means it will be relevant to this situation, right?
Yeah, exactly.
Context
So
of the
Nadia,
country.
go ahead.
Is it the context of the our community or community? Because
Exactly.
how will discuss with the children? How can make him or her feeling feeling good? So it will depend on context to context and situation to situation. Is it?
Yeah. So think about in the population that you're working with, in the communities you're working with, how would a child help another child feel better?
Yeah.
Yes, yes.
Yeah. So examples, again, the examples here, let me scroll down to the example sheet here. Would be here that give her a hug, tell an adult, ask them what's wrong, talk to her, bring her a glass of water, tell her a joke. I think the chocolate example might be relevant in your context. Yeah. Yeah. So think about the context. These might be relevant, they might not.
Yes.
Yeah. That's why it says example only, do not use, because they may not be relevant in your context. So you want to think about what is relevant in your context. And the same with the angry questions. Any other questions on the empathy section? Okay, the other thing that I would make sure is that whatever picture you decide to pick of the angry child and the crying child, that you have those printed for the enumerators. So they need to have a copy of those pictures when they sit with the child. Ideally, you would have them laminated because it lasts longer that way. But if you don't have a laminator, you don't need to do that. You can just have them printed. But it's just important that the enumerator has the child materials. All right. Any other questions on empathy before we move to growth mindset?
I have not a question, Alice.
Yes, please
just
go
a
ahead.
comment that whatever situation come to the enumerator, if he try to maintain the empathy relevant to the situation, there will be better answer from the children, I think so. Is it correct?
So the responses from the child, we should think about what a child would say in these communities and what a child would do in these communities. So the enumerators ideally would understand these communities, maybe be from these communities, and basically know how children respond in these communities. So they would be ideally able to give you some examples, as well as you all know these communities well. And so you can think of examples of appropriate and inappropriate responses.
Right.
Yeah, and before the data collection training, you can actually just add the responses in here that you think are appropriate and inappropriate, and then talk it out with the enumerators. Or you can do this on sticky notes with the enumerators.
Right.
Yeah, or both. Yeah, and these are just examples in case you are trying to think of some and can't think of any others. All right, now growth mindset is really straightforward. So they just need a copy of the translated assessor survey, and this is a new section that's only for the adolescent tool that we are using in Bangladesh. So this has been added actually for this specific project, for Skills to Succeed. So what growth mindset means in social and emotional learning is that children believe that they have intellectual abilities and personality traits that can be developed, or qualities, that should be an or, that can be developed and improved. Also that children express confidence in themselves and their ability to improve or succeed. That children see challenges as things that they can take on and overcome with time and effort. So that's what we mean by growth mindset here. So how do we define growth mindset in programming? And again, this domain has never been used before with ISELA. So this is a new section that we're going to analyze specifically in this program. And honestly, it's great because we'll be able to then build on this section and apply it in other contexts. So this is a great opportunity to further develop this tool and to learn how to measure growth mindset. So where we got this tool from is a report, and I put the link in the PowerPoint, and it's a report from a Columbia project that used a similar adapted ISELA. So you can see this report on this link if you open the PowerPoint, and I can also share it if you're interested. But they did use this section to measure growth mindset. So we've never used it in Bangladesh. And we don't know exactly how well it's going to measure growth mindset, but we have used it before as Save the Children. So these are the questions that we ask that are adapted from this tool used in Columbia. And again, the enumerators should ask all these questions the same way they appear here. But these are just simple yes/no questions. So tell me whether or not you identify with each statement, yes or no. I think I can learn new things. So yes or no, or they say, I don't know, or if they stay quiet, it would be marked as no, I don't know. If they say, I don't want to answer this, or I don't want to tell you, it would be marked as no response. That's an important distinction. If the child stays quiet, that means they do not know how to answer the question, or they are not displaying the skill. So that's an important thing throughout the assessment to keep in mind, and we'll go over that again later. I'll emphasize that again later, but I'm just mentioning it now because this section is really straightforward. So it's, I think I can learn new things. I know how to use my time and organize my work well to achieve my goals. When I encounter a challenge or a difficulty, I see it as a way to help me improve. I believe that when someone corrects me, they help me learn and grow. I am inspired and motivated to work harder when I see that my friends and the people around me are successful. So these questions are again measuring whether or not they think that they can improve, that they believe that they can learn new things about themselves and about the in order to achieve their goals. Any questions on that? Again, these questions are very straightforward. They should be easy to ask children.
Yeah, I think this question is very good for our countries also, our context.
Great. Yeah. No, I'm looking forward to the data on this because, again, I think we'll be able to have a very well, constructed, analyzed, tested tool from this project that we can use with other adolescents. So this is it's fabulous that we have this section here. All right, conflict resolution. So this again, we're going back to appropriate and inappropriate responses. So the conflict resolution section, follows the growth mindset section. Oops. So what are we measuring in conflict resolution? We're measuring whether or not the child has strategies and methods to peacefully negotiate a dispute with their peers. So to handle a conflict with a friend or with some other peer. So this is the question that we ask. And honestly, I've done role play with enumerators for this so that they're acting this out. But basically what we ask is for the child to imagine a situation where they're like playing with a phone or a game or a toy that they like. So here I have a picture of two girls playing with a phone. And then the other child wants to play with the same toy, but there's only one. Now imagine the same situation that they're playing with the toy or game and the other child wants to play with it. There's only one. This time the other child takes the toy and starts playing it without asking you. So let's say this other girl who's not holding the phone grabs it and takes it out of her hands. And basically what we're asking is, what would you do? And we're trying to identify appropriate and inappropriate things that the child can do to solve this conflict. So what are some appropriate and inappropriate ways that a child can respond to the first scenario where the other child just wants to play with it, but there's only one? And the second scenario where the other child wants to play with it, but they take it. So here are some appropriate and inappropriate examples, and this is what we ask. I'll rearrange this because I don't like how it's structured right now. So the data that we collect is, imagine the scenario, and the questions we ask are, what would you do in this situation? And then we ask that follow-up, is there anything else you would do? So again, going back to these examples, an appropriate example would be sharing the toy or the phone, take turns playing it, give the other child the phone or the toy, ask an adult, see if there's another phone that you can play with or another toy that you can play with, find something else to play with. An inappropriate response would be like hide from the other child, avoid them, run away with it so that they can't play with it, get in a fight with them, for example, yell at them. Those would all be examples of an inappropriate response. Okay, and then the next, the more complicated section, and you'll see here the skip pattern. If the child cannot respond to this situation, then you don't tell them the further story, and you skip to the next section. So in this, if they can identify what they would do in this first situation, and then they can identify another thing that they would do in this first situation, you ask them the more complex situation. So now the conflict has escalated. The other child has taken the toy and started playing with it without asking. What do you do in this situation? Is there anything else you would do in this situation? And so here are the example appropriate and inappropriate responses. They could ask an adult for help. They could ask to share the toy. They could go find another toy. The inappropriate would be ignore the other child, run away from them, punch the other child or fight with them over the toy, try to take it back. Those would all be inappropriate responses because they would be escalating the conflict. And so this is the conflict resolution section. It's just these 4 questions about what you would do in the scenario, and then the more complicated scenario. Oh, and then here's an example. If the child asks, like, well, what game is it? Maybe the child it doesn't really care if it's like they're playing like a silly game on their phone, but they do care if it's like their favorite toy. And so you ask, well, what toy do you like playing with? So there's an example of a prompt that you could add there. Any questions on the conflict resolution section?
Ellie, could you please back to the first slide? I have a question. Please go to the back slide. First slide. First slide. This one.
This one.
No, this one. No.
Next one.
This one, right? Conflict resolution group discussion. We will conduct interview individual participants. So why group discussion here?
When we say group discussion, we're talking about the data collection training. We're not talking about with the child.
Yeah.
So with the data collectors, this would be a group discussion about what they would do, what they would think is appropriate or inappropriate responses that a child could have in this scenario. Again, yeah. I've had data collectors actually act out this scenario and like show what children might do, just as a way of interacting, engaging with the data collectors. So it's more fun and less of, you just talking to the data collectors.
So it is related just training, right?
Yeah, so this is the group discussion. Anytime it says group discussion, it's related to how you're training the data collectors.
Thank you so much. Thank you.
Yeah. Yeah, we never do a group discussion with the children because we never interact with them in a group.
I was a little bit confusion here. Okay, now clear. Thank you so much.
Great. Yeah, and I think in the notes, you'll see that some examples of like what you role play or things you can do on this slide. So you can look at that in the PowerPoint as well. Any other questions on the conflict resolution before we move on? Great. We might make it through this whole assessment, and then tomorrow we can practice on the Kobo form, which would be fabulous. We have, what, 45 minutes left? Thank you all for sticking with me too. I know it's quite late. Yeah, so we only have a couple sections left. We're going to go through the social skills and communication. This one is also very straightforward. And then there's the higher order thinking skills and the self-concept section. So social skills and communication, again, this is a new section that we have never used before. And this is actually sourced from another tool. And here it is. So what we're measuring with social skills and communication is whether or not the child can assert themselves in an appropriate manner during a conflict, whether or not they can follow instructions and understand the appropriate behavior in context, whether or not they can understand the actions and behaviors that foster friendship, build and maintain positive relationships. So what I think will be interesting also with this section is comparing it with the relationships questions. We might see some relationships there. But this section was added because it was specifically identified as questions and skills that you're focusing on in the skills to succeed section. And the other thing we're measuring here is whether or not the child can manage or cope with an unfair situation or a situation that the child perceives as to being unfair. So again, these are pretty straightforward. We're actually using a Likert scale here. So please tell me how much you agree or disagree with each statement. So I am good at following instructions. Totally agree, disagree, or strongly disagree. I am able to defend myself without belittling others. Totally agree, disagree, strongly disagree. I get along well with people from different backgrounds. I find it easy to make friends. I can control my anger when I have a misunderstanding with a friend. So we want to see whether or not children are able to, basically, understand the context, understand and communicate clearly with others, build relationships with others. And so again, we might find this is related to some of the other questions that we ask. And I think that'll give us some really interesting information. So the group discussion, again, this would be with the data collectors, is defining social skills and communication in our programming. This section is derived from this measuring soft skills among youth and young adults. And it was designed to be used with older youth. So will also be interesting to see how well this measures the 8 to 14-year-olds social skills and communications. So our use of this scale is the first time it's going to be used with this age range. So we'll be able to understand that better as well. Does anyone have any questions or comments on this scale? For what we're measuring here? All right. If there are no questions or comments on social skills and communication, we can move to higher order thinking skills. So this is another new section that we have not used before with ISELA. So we will be testing this section in this program. And what is higher order thinking skills? I wasn't sure. So that's something we need to discuss a little bit more on what we mean by higher order thinking skills. But what it's defined as in this tool is being able to solve problems, to ask other people to work to solve problems, to think of different ways to solve problems, and to make planning. So higher order thinking skills can be about analysis, but what we're focusing on here is really problem solving. And so I think we're going to probably see a relationship between this section and the questions we ask about relationships. So do you ask someone else for help when you have a problem with a friend? That might be related to higher order thinking skills. We also might see a relationship between this and conflict resolution. So that'll be really interesting. So really what we have in terms of the higher order thinking skills is looking at problem solving and analyzing situations. Oh, and this is really important that we're asking them to think of the last few problems that they had, and then how much they agree with these statements. So that might be, they might need help to think about like an example of the last problem that they had. And so you might want to ask them, you know, tell me about the last problem that you had. Oh, thank you, Melissa, for putting the definition. Yeah. So we're looking at here, evaluating context, identifying relationships that we can use to solve problems, making healthy choices, generating new ideas, making a plan to solve the problems. Okay, these are not the only questions we ask here. The next part of higher order thinking skills is about the last few times you made a decision. So the decision making here, using judgment. So we ask them about, they collected information before making their decision. They thought about other people, how other people would be affected by their decision. They considered different options before making the decision. So again, if the child's having trouble thinking about a decision that they made recently, the enumerator can ask them to give them an example. So can you tell me a story about a decision that you made? And the decision doesn't have to be big. It can be something like they decided, you know, to go play football with their friends instead of doing housework. Whatever it is, you know, they need to think of a decision that they made recently. And Melissa, I'll add this definition into the slide deck. So again, thank you for sharing it. And lastly, we ask them questions about the last time someone told them an interesting story. And then we're asking them basically, did they analyze this story? Questions about whether or not someone in this, they questioned why someone in the story did what they did, or did they connect pieces of evidence together? And so again, that one may be tough for the younger children. And if they don't answer it, you can mark it as unanswered. And we may end up seeing that we have a lot of these that are skipped because these questions might be tough for like an 8-year-old or a 10-year-old. But we might see that they're, you know, connecting different evidence. And they might, they might have trouble thinking of stories that they've heard. So the data collector can ask them to share a story that they've heard from someone else. All right. So this would be a discussion to have with the data collectors about what might come up from the children. So what kind of problems children might face in this context, like problems with friends or family members, problems at school, what kind of decisions the child might make in this context. So again, think about your community. What decisions might children be making? Like deciding what game to play, or even what to wear, deciding, you know, what to do during a day, deciding, you know, what, I don't know. I actually don't know what decisions children might make in this context. So you will need to think about this so that you can help the enumerators, you know, give them prompts if they're unable to think of a story. And then what kind of stories might children have heard in this context? Again, like maybe stories at school from caregivers, maybe a friend tells them a story of something that happened to them. And so those might be examples. And then I have here the question about how do we define higher order thinking skills in context? And then you can see where this is sourced from. It's also from that same tool that we've sourced the social skills questions. So any questions on this scale on what we're measuring with higher order thinking skills? Any comments about this?
I have a question that for the children. Can I ask? Hello?
Yes, go ahead.
For the children, it is it will be a bit difficult to understand how they can solve their problem and etc. in higher order thinking skills. So when we will recruit the data collector, they have to be a very knowledgeable, and they have to be knowledgeable on that issue, so that they can ask the proper question to the children and get the proper answer from them. And this is the one of the vital recommendation for me, because total research or total result will be depend on the data collector. Therefore, they should be very equipped with this thinking, with this module, and they should be well known to the what is uh, cell GM and what is the content on in this inside. So,
exactly. And that's, I mean, one of the reasons we're doing this workshop is so that you all can help the data collectors understand what we're asking, as well as help them know, how to prompt children, what are some examples? If you go ahead here, what are some examples? Oops, too far. Of problems that children might face, of decisions that children might make, and of stories that children might hear. And so we don't necessarily need to know the problems, the decisions, or the stories, but if the child is having trouble thinking of those, the data collector needs to be able to help them think through those so that they can answer the questions. If the child is not able to think of any problem or any decision or any story, then we're not going to pressure them. We'll just skip those sections. And so we'll need to have a skip in here just in case the child is not able to think of a problem that they've had, or they're not able to think of a decision that they've made. That tells us something as well. That tells us that that child is not able to display that skill.
okay.
Yeah. And again, one of the things that's really important with the data collectors is just because the child is not able to display that skill doesn't mean there's anything wrong with the child. We are not judging the individual child. Again, this isn't an individual assessment. We just want to know, on average, what are the skills that children are able to display, like at baseline, and then maybe at end line, we see an improvement. But we're not judging the child. We're not like, oh, well, this child doesn't have higher order thinking skills. They couldn't think of a story that they heard. That's important that the data collectors know that we're not judging the individual child. There's no grade, there's no passing this assessment, and there's no failing this assessment. Any other questions on this or comments?
No, thank you.
Okay. All right, last section. We are going to get through the entire tool today. I know it's quite late. Thank you all for being here with me this late in the day. I hope you're doing well, and I hope your families are okay with you being on this call. But yes, so self-concept. So self-concept, what we're measuring is the ability to understand and express personal preferences, feelings, thoughts, understand your own abilities. It also refers to your capacity for independence and confidence. And what we're measuring here is also whether children can imagine a hopeful future for themselves and identify realistic supports and barriers to that future. So the questions that we ask, and you can ask these questions with the data collectors and actually practice this with them, as we ask them to think about something that they hope will happen in their life in the future. Anything at any time in the future. So 1 year, 5 years, 10 years, anytime in the future. But we're talking about something long term. So not something that they want to happen next week, or later today, something that's in a year in the future. And then we ask them to draw a picture of that so that it's engaging. We're not going to assess the picture. It's just something for them to do so that it's engaging. You know, at the end, they're thinking about something hopeful for themselves in the future. They can draw whatever they want. And after they finish, that's when we're going to ask the questions for the in the assessment. So we do identify whether or not the child attempts the drawing. But again, that's not part of the scoring. We're just keeping track of that. And then we identify whether or not they include themselves in the drawing. So sometimes they'll draw something that's not relevant. But again, we're not assessing their drawing capabilities here. We're just marking whether or not they've included themselves in the drawing. The questions that are part of the self-concept domain that we actually are using for the scoring is, can you describe what you hope will happen in your life in the future? So basically asking them to describe what they've drawn, if they decided to draw. They might not draw at all, and that's entirely fine. And then the can you describe insert activity is if they tell you an activity and you want more details. So like, let's say they say, I want to, this would have to be only if the answer is unclear. So an unclear answer might be like, I want to be Beyonce. Beyonce is a famous singer. So you might say, well, can you describe being Beyonce to me in more detail? And if they say, I want to actually become Beyonce, that would be an incorrect response because they cannot actually become Beyonce because Beyonce is an existing human being and they cannot become Beyonce. However, if they say, I want to become a famous singer, that's something that could happen in their life in the future. We're not judging the feasibility of this happening. We're just judging if they can identify something that will happen in their future or could happen in their future. And so that would be marked as correct. And then we ask them to identify something that could stop them from becoming a famous singer in this example. And if they can think of a realistic obstacle like money, or I'm not a very good singer, those would be correct responses. If they are unable to think of something that would stop them, if they're like, nothing would stop me, that would be marked as incorrect, do not know, because they're actually unable to identify an obstacle. And what we're trying to see here is if they can identify realistic obstacles to a potential future. The skip logic also, if they're unable to answer any of these questions, you skip to the end. Again, we're not judging the quality. We're not judging or valuing what the child hopes for. We've had children hope for like negative things, like I want to become a gangster or a criminal, famous criminal. Like that is something that could happen in their future. Just because we don't think it's appropriate or we don't like it doesn't mean that we would mark it as incorrect in this context. And this one, we're just trying to see whether or not they can identify something that would happen in their life in the future. And then also, we're not going to value the barrier that the child identifies. We're not judging it. We're just identifying whether or not it's a realistic barrier. And then we ask them something that would support them in achieving this, becoming a famous singer or becoming a famous criminal. What would help you do that? And then we ask them if they can think of another potential future for themselves. Maybe they want to become a famous singer and they want to become a doctor. Or maybe they want to become a famous singer and they want to move back to their home community if they're displaced. Those would be realistic, potential hopeful futures. And then one other thing that could stop them from doing the other thing that they hope for, and one thing that they could help support them in doing the other thing that they hope for. If at any point they are unable to respond to these questions, you skip to the end. If they've drawn a picture, take a picture of it, just because the child will then, it helps them feel valued. They'll feel positive at the end of the assessment. And if they give permission, of course. And then that's it. You thank them for the end of the assessment, you thank them for their time. So any questions on self-concept or comments? Nazma, did you have a question or comment? I see you unmuted.
Actually, I don't have any question. It is very clear to me. So you can go ahead.
Great. Well, honestly, this was what I wanted to get through today. I'm going to go back up to the agenda.
Yes.
So we can talk about what we will be doing tomorrow. So one of the important things that we went over today, obviously Ascent and the entire tool, and the appropriateness of responses. So this is really important in ISELA. So obviously child safeguarding and Ascent, that's important in all of our data collection. We want to make sure that the children are safe. We want to make sure that they agree to participate in the assessment. But for ISELA, what we need to make sure is that our data collectors during data collection are scoring each response the same way across data collectors. So we don't want one data collector saying something is an appropriate response and another data collector saying that the same response is inappropriate. We want to make sure that everyone understands what an appropriate response is and an inappropriate. Yeah, Nazma?
And yes, that's what I told sometimes before, that their concept must be clear. What should be the appropriate approaches and what should not, and what should be the inappropriate approaches, and their concept and understanding should be clear. So and I hope they will be trained this way, so it will not be a problem for data collector. And I hope this will be in Bangla. When it will be in Bangla, and data collector will read and memorize this, and their approach would be appropriate.
Yeah, exactly. And the training that you do with the data collectors should also be in Bangla. So all of the data collection should occur in Bangla, not in English, obviously. It should occur in the language that the child knows. And the data collectors should help you with this contextualization process. So in like the empathy section, here, let me zoom out. We want to make sure that the data collectors are giving appropriate and inappropriate responses, that they have examples, that they can think of appropriate and inappropriate responses, that they understand the non-hostile and hostile response for empathy.
Yes.
This is really important. And given that we are all talking about this now, and I am a teacher by training, I am going to give you homework. Because we didn't spend a lot of time going over example appropriate and inappropriate responses. I will ask you to do that for homework. So think of appropriate and inappropriate responses for homework. So tomorrow during the day, not tonight because it's late. Tomorrow during the day when you're at work, think of appropriate and inappropriate responses to these sections: stress management, conflict resolution, empathy, and self-concept. And I want you to make a list. And I want all of you to make a list of appropriate and inappropriate responses that could come up in context to these sections. And you can actually write them into this PowerPoint, or you can send them to me in email. You can write them in a Word document. The Word document that I shared, you can put them in that. We just need to think of these appropriate and inappropriate responses to these sections that could come up. Children are unpredictable. They might say things that we don't anticipate, but think about what would be appropriate and inappropriate responses in this context. Does that make sense?
Okay.
Great. I love giving homework. That's another thing to do with the data collectors. So I have a shared folder here. I'm just showing it. And it actually includes homework assignments that you can give data collectors during the training. And these are like cognitive, basically to understand whether or not they are following along. Like why Why do we assess social and emotional learning? What are the key skill areas in ISELA? What are 3 ways? Oh, this one is important. We'll talk about this more tomorrow, about building rapport to help children feel comfortable. We'll talk about administration rules more tomorrow as well. Questions that they have. Now, I'm not giving you this as homework because you are data collectors or you are experts, but these are examples of things you could give to the data collectors in the enumerator training. Yeah, Yusuf, go ahead. Yusuf, if you're speaking, you're muted.
Yeah, you can go ahead now. But I have a question about background section. I have a question on background section because I was disconnected that time due to unavailable electricity. I have a question like, what language do you speak at home? Did you discuss this question? Yeah, right. What language do you speak at home? Yes or no? I missed this
so
question.
this was contextualized by, sorry, go ahead.
Yeah. What will be the answer? Is it only yes or no? But we have seen here a lot of few answer like Bangla, Hindi, Urdu. What will be the answer actually? Yes, no, or these items? What?
Language.
Yeah, so in the Kobo form, you would actually just mark the language that they say that they speak at home. And you could read these in case the child doesn't know what you mean for some reason, like Bangla, Hindi, Urdu, something else. And then you would, if there's an other, there's an option to actually put the other language. But yeah, it is a yes, no question in the analysis. A yes Bangla, no Bangla, yes Hindi, no Hindi. And but in the Kobo form, which we'll look at tomorrow, it's just a checkbox.
Yeah, understand.
Yeah.
I was
And
not
then
clear actually at that time.
they might speak more than one language at home. So maybe they say, well, we speak Bangla and Hindi at home.
Before same as
yeah,
B3,
so
right?
you would mark
Yes.
both boxes.
Yeah. Thank you so much. Thank you.
All right. Nazma, did you have a comment? I saw you unmuted. All right. Well, we can end 15 minutes early and you all can get some rest. Tomorrow we will review the full tool again. And I know it will be redundant, but it is very important that you all feel very confident in the tool. But we're going to review the Kobo form, not the PowerPoint or the Word document. We'll review the Kobo form so you can see the skip logic, you can see what the options look like, and you can feel confident with that tool. And then we'll also review the homework, which is for you to think of appropriate and inappropriate responses and come up with a list for the stress management, conflict resolution, empathy, and self-concept questions, and share that with me. Email it to me in Word, email it to me in this PowerPoint itself, however you want to do it, just email me those examples. We'll review that together. And then we'll talk about planning a little bit and the enumerator training planning. If you can send me the population figure for your different locations, then on Wednesday, we can talk about the sampling. So that would be another piece for homework. I think that might be on you, Yusuf. I'm not sure who is leading on the sampling, but the population number would help us talk about the sampling. Oh, yes. And thank you, Melissa, for sharing my email. My email is in the chat.
Yes, thank you. And the population question, I think, would be for either Yusuf or Mobashar. I think I sent you an email about that, but we can talk about that as well on Wednesday.
All right, I put in the chat my other requests to share the population size for the sampling conversation. And yeah, looking forward to hearing from you all and seeing you all tomorrow.
Okay.
Great.
Great.
Thank you
And
all. Thanks so much, Allie. Talk to everyone
yeah, thank
tomorrow.
you.
Thank
And thanks
you,
for the
Ali.
participation.
Patience,
Thank you
yes,
very
thank you
much.
very much.
Thank you, Ali and Melissa.
Thank you.
Thank you all.